In 2025, Skagit Regional Health launched a multi-year strategic plan that defines our overall direction. When you hear the term strategic plan, most people expect to hear just about goals and objectives. But in writing our 3-year plan, we also took the opportunity to reframe our mission, vision, and values, as well as define themes, create goals, and then identify specific initiatives to meet them. To recap, our mission and vision state our purpose for being and what we aspire to become. Our values guide our actions and define our culture. The mission, vision, and values remain constant and are the foundation upon which we build our strategic plan. Now I'll introduce strategic themes, which give structure to our organizational goals. Consider the themes as pillars. Our themes are people first, clinical excellence, one system, and focused growth and development. The themes describe areas of focus for our 3-year strategic plan that begins January of 2025 and ends in December of 2027. These themes came from both financial and population data, together with input provided by employees, providers, and our community. The themes describe areas we need to address as a public hospital district to improve the health of our communities. Let's examine each theme more closely. People first means improving engagement and satisfaction of our patients, providers, and staff. By doing this, our 3-year goals for People First are to become the healthcare system of choice for patients and to be the employer of choice for the entire care team.
Focusing on patients, our objective is to increase the number of patients who rate our hospitals and recommend our clinics to others, as measured by the Press Ganey Patient Survey.
We will take steps towards this by reestablishing the Patient Experience Steering Committee, which will then examine the data, recommend the areas of improvement, and then implement ways to address issues and track progress. Additionally, we will identify a customer service training program for the entire organization. Focusing on staff and providers, our objective is to improve our engagement scores. Knowing that health benefits are an important aspect to attracting and retaining staff, we will transition to a new insurance broker that will provide competitive insurance benefits and rates aligned with the market. We will also focus on supporting leaders through professional development and establishing performance evaluations based on core competencies. Clinical excellence addresses the need to provide consistent, reliable health care. Under this theme, we want to be a leader in high quality, high-value outcomes for all patients. We will accomplish this by using data and clinical informatics to improve care. Tracking data improves clinical excellence by allowing us to make more informed decisions, identify trends, and act proactively. Maximizing our investment in the Epic electronic health record system is not only necessary, but wise. It is a powerful tool that helps us not only optimize patient care, but improve workflow efficiency. To be a leader in high-quality, high-value outcomes for patients, we will prioritize improving our inpatient and outpatient quality metrics. And, remaining true to our values, we will also focus on delivering equitable care for all of our patients. This means a laser focus on inpatient measures for mortality, safety, readmissions, the patient experience, and timely care. In the outpatient setting, we will encourage preventative screenings for breast and colon cancer, hypertension, and diabetes. In these changing times, we will monitor and remain compliant with changes in the state and federal policies while maintaining the value of equity in patient care. One system describes a state of being where all of Skagit Regional Health works together to promote patient-centered care. This is done through supporting teams to do their best work under integrated operations across the system. Under this theme, we will work towards seamless transitions of care for patients and for our employees, a unification of culture and process across all of Skagit Regional Health. Having seamless transitions of care minimizes medical errors and improves patient outcomes. In this first year, we will define and take steps to develop service line structures. We'll also work to connect patients in the urgent care and emergency room with primary care providers. Then, we'll create a system-wide approach to care transitions enabling coordinated care for patients, especially those with complex needs. The unification of culture and process is essential for creating a clear framework for how we approach our work in a cohesive way. The first step is really understanding our mission, vision, and values to guide our actions and our decision-making. A culture of safety supports open communication, prompt reporting of issues, and a proactive approach to identifying and addressing potential risks. By using common practices and sharing data, a culture of safety promotes staff and patient safety and a positive work environment. 2 years ago, we invested in Infor, a platform that helps manage and streamline functions such as finance, human resources, and materials management. We will continue to expand the use of Infor to standardize our processes. Focused growth and development calls for us to thoughtfully evaluate and plan for new growth opportunities, while being careful with our resources and being strategic in our decisions. To achieve this, we will run Skagit Regional Health efficiently, measuring success with positive or improving finances. We will also develop infrastructure to meet the healthcare needs of our growing communities and provide the right service at the right time and place. The healthcare industry continues to face challenges in the area of finance, with rising costs and decreasing reimbursement. Monitoring our financial data has never been more important, and that's our first step to improve efficiency. Labor costs are the single largest expense in healthcare. Maintaining appropriate staffing levels is key to delivering safe care while providing for our long-term financial future. Establishing new revenue streams is another way to improve our income. This year, we will open a specialty pharmacy to improve patient outcomes and support while also generating revenue. Space is a valuable resource in any healthcare facility. Effectively utilizing existing space to its full capacity is the smart, sustainable thing to do. Realizing our limitations, developing partnerships and affiliations is a way to expand our services and our reach. We have had success with this model and plan to pursue more opportunities. Our southern market is growing. We need to keep pace in order to meet the patient access challenges in Arlington. Making plans to build a new medical office building in partnership with Public Hospital District No. 3 is a top priority. Ensuring patients have timely access to care is the basis for improving our referrals and authorization process. Expanding the availability of medical oncology and infusion services also helps with this effort and really addresses meeting this crucial healthcare need for our cancer patients and our aging population. Optimizing patients' length of stay serves many purposes. It improves patient safety, enhances efficiency, and allows us to better utilize much-needed bed space. While better for the patient and staff satisfaction, it also leads to lowering costs. All of these goals are supported by detailed timelines, action plans, and measurement. Altogether, this makes up our strategic plan, our roadmap for strengthening and evolving Skagit Regional Health, all while providing exceptional healthcare always.